Mastering dental imaging, techniques for perfect bite wings and periapicals. As operators, we're taking bite wings and periapicals all day long, so ensuring that we have the right technique to capture these images in the least amount of takes is really important. Getting buy-in from your patients before you start capturing images is really important. In pediatric dentistry, we do something called tell, show, do for every patient. We tell them what we're gonna do before we do it, we show them what we're gonna do, and then we actually do that. And I think that's really great for x-rays as well. Let the patient view the sensor, let them feel what it feels like in their mouth before you start capturing images. I think desensitizing our patients and allowing them buy-in before we get started really helps the process go smoothly. One of the best things we can do as operators to ensure we're consistently getting the best image is using the sensor holders and positioning rings. Holders are great because they help you align the sensor with the patient's teeth and x-ray beam. If we think of an x-ray beam coming out of the generator in a straight line, we want that beam or line to meet with the sensor and teeth perfectly head-on or perpendicular. Begin every imaging session by ensuring the sensor cable is properly protected. When the patient bites down on the positioner's bite block, make sure to position the sensor cable close and parallel to the bite block to prevent the patient from biting on the cable. Whether we're taking bite wings or periapicals, we always want to practice good techniques when aligning the sensor with the x-ray beam. The positioning ring can help us with this. We want to slide the ring all the way down to the holder until it touches or almost touches the patient's face. Then we'll align the x-ray tube so that it's close and in line with the positioning ring when exposing the sensor. Taking the time to do these steps will help you to get consistent, well-exposed images, ultimately minimizing retakes and an unnecessary exposure to the patient. Like the name suggests, when using the paralleling technique for PAs, you want to place the sensor so that it's in the same line as the long axis of the tooth or teeth. The long axis of the tooth is like an imaginary line that runs from the top of the tooth down to the tip of the root. For front teeth, this long axis line is actually at an angle when you're looking in the mouth, so you would need to position the sensor at about a 30 to 45 degree angle behind the front teeth to keep the sensor parallel with the teeth. For back teeth, like molars and premolars, this long axis line is aligned more upright, so the sensor will be placed between the tongue and the teeth, but more straight up and down, instead of at an angle relative to the teeth. Lining up the sensor with the long axis of the tooth and making sure to aim the x-ray tube so it's parallel with the sensor and therefore parallel with the tooth allows the x-ray beam to hit the sensor straight on and perpendicular, minimizing distortion of the teeth in the final image. Using the included holders and positioner for your Jazz sensor will help you best align the sensor beam and x-ray beam to do this. The goal of a PA is to get the entire root and crown of the tooth so that you can see the entire tooth or teeth that you're trying to capture. For bite wings, you want the sensor to be placed in the mouth between the tongue and the teeth. The patient will bite down gently so that the sensor is placed evenly between the upper and lower jaws. You want your x-ray tube to be as parallel with the sensor as possible so the x-ray beam can go exactly perpendicular to the sensor. The goal of a bite wing is to see the top part or crown of the upper and lower teeth evenly, have the interproximal or the in-between the teeth spaces open, and to see the bone levels of both the top and bottom teeth. These small adjustments can make a big difference in the results of your dental imaging.